Hello, happy Passover. My name is Nadav Davidovich. I'm a public health professor. I'm the director of the School of Public Health at Ben-Gurion University. And I want now briefly to present some insights related to the coronavirus pandemic, being also a member of the Center for Health, Humanism, and Society at Ben-Gurion University. So first of all, those who are involved in public health maybe are not so surprised with the current events, with all the magnitude, of course. Changes in globalization processes, other issues such as climate change, ecological disruptions were perceived already for more than 2 decades as potential effects that can lead to such a pandemic. When we are looking now on the different interventions, including in Israel and other countries, first I want to stress that although the current events are very powerful, finally we need to understand that the interventions are based on the existing structures. So we can see in different countries how the power relations are framing the way that the different responses are taking place. We see how different vulnerable groups many times are not taken into consideration. And we see also, unfortunately, how many times the response is framed in very narrow epidemiological considerations, while actually public health should be defined as related to social, economic, and political determinants of health. So if we're taking public health seriously, if you're thinking about solidarity, inclusion, basic values within public health, we can definitely try and see and envision a different approach than the usual one. We are now in Israel thinking about several exit strategies, and of course we need to think about expectations, but it's quite clear that in public health, finally, we need to balance between corona and non-corona related events. We need to see how different groups should be much more involved in framing our response. And we need to see what we are measuring, because all different graphs and flattening epidemiological curves finally cannot encompass the human broad reality. And of course, measuring only corona-related illnesses would not be enough. We need to see how the mental, the social, and other non-corona-related illnesses are being approached, and how the different parts of society are taking part. Other processes that are very important to take notice is, unfortunately, the tendency of different societies to enforce racism and to see how differences are not taking place in the current way. I want also to mention that in Israel, at least, it's amazing to see how social and how the civic society are now engaged and criticizing, but also taking place in reshaping the response. So if we take now the Arab society and the Bedouin society in the Negev, or some of the Haredi society, we can see now how in different communities, including engaging the municipalities, the welfare services, pushing and changing the way that the government is responding. So just before entering to the next phase and thinking about exit strategies, it is very important to introduce a public health ethics and biopolitics kind of approach that is taking into consideration the different power imbalances and taking them seriously in order not to be just responding to an epidemiological, quite narrow approach. And for this, we need to see how all different disciplines and all different sectors are involved in what we call health in all policies approach. I really hope that the current challenge will give us some ideas that were present also before this event, and to restructure the healthcare system, thinking how the public system would be the most important component in addressing healthcare in the future, rethinking the balance between hospitals and community that we see now, and rethinking how different parts of society should take part in any healthcare restructure. So I really hope that all of you are now with your families, with your communities, and I want to give again some hope that we all know that we are going to end this pandemic, and the way we are going to finish it is very much related to our response and the strength of the different societies. So happy Passover, and hope that next year, as we say in the Haggadah, we'll be together, free in a way, and also now to think about physical distancing, but not about social distancing, because solidarity now is more important than ever. Happy Passover.